I'm Lauren St. Germain. Medical breakthroughs are only possible when brave people put their lives on the line. A young mom was diagnosed with stage 4 metastatic breast cancer last year. Doctors gave her 5 to 7 years to live, and she decided that was not an option. So when a doctor at Moffitt Cancer Center gave her another choice, something new, an experimental treatment, she jumped on it. I had a conversation with that doctor to learn about the groundbreaking research happening right here in Tampa Bay, and I listened to the young mom about her decision to take a chance.
So my cancer journey first started when I was pregnant with my second son in Birmingham, Alabama. I noticed a lump in my left breast, and I brought it up to the nurse practitioner overseeing my care.
Dallas Carroll tells me months went by.
I consistently brought it up, and it was always kind of pushed back that it was just normal hormonal changes.
And finally, a few days after she gave birth to her son,
An ultrasound, a mammogram, and a biopsy on December 7th.
doctors confirmed her fear. She has breast cancer.
Then by December 17th, it was confirmed stage 4. So it had spread to my liver and my bones.
We met Dallas in between appointments at Moffitt Cancer Center. She's here in Florida now, moved here with her family for treatment.
And they told me that I could do standard care, which yielded 5 to 7 years left to live. And as soon as I heard that, I decided that wasn't gonna work for me. Because that would put my youngest at 5 or 7 years old, and my oldest at like 8. And they need a mother longer than that. So I said no. And Dr. Zernicki said that he had a vaccine that he could try, and I would be the second patient. And I said, okay. I didn't care what it was. I was already gonna do it.
We're using the person's own immune system to treat their cancer.
Dr. Brian Zernicki is the chair of the Department of Breast Oncology at Moffitt Cancer Center. He breaks down the dendritic cell vaccine.
So it's a cross. It's a vaccine, but it's also a cell therapy.
And the shot goes directly into the tumor today?
Yeah, that's what we found it works best. In fact, if you give it even in the organ but not into the tumor, it doesn't have the same effect as when it's put in and admixed into the tumor microenvironment.
Moffitt allowed us special access into the lab where researchers are working on these personalized vaccines to learn about how they're created, as long as we didn't show anything that could compromise the scientific process.
What it's doing is reprogramming the area where the tumor is, because when a tumor forms, it's not all cancer cells. It's composed of a lot of other cells to help it. Now those cells get reprogrammed to be anti-cancer, and when they get programmed that way, now they can go out to other places in the body and they're told, oh, anti-cancer, and we'll get rid of it wherever you see it.
Dallas is one of 2 young women with stage 4 HER2-positive breast cancer receiving this treatment. But doctors have already done trials with other subtypes of breast cancer. What are some of the results that you're seeing?
So we've been seeing like breast tumors disappear in the breast, the primary tumors, go away even without any chemotherapy.
Scientists are creating personalized vaccines. Here, they're preparing the one for Dallas.
I would get those weekly, and literally I could feel like the tumor getting smaller each week.
She's had 2 rounds,
The spots on my liver are completely gone.
then chemotherapy, and is now waiting to get approval for a 3rd round.
Dr. Zernicki thinks that with the next round of vaccines that he can clear the rest of that tumor, and if not, he can just do a lumpectomy, which normally stage 4 doesn't really have any surgical options.
What is it like for you to be able to have that option when this was not even on the table a year ago?
It's so surreal. Like, sometimes like I'm still like laying in bed with like my eyes wide open at night, and I'm like, what is my life? Like, how did I get so fortunate but so unlucky at the same time with this diagnosis?
For Dr. Zernicki, the future of this science is bright.
The realization that we might be able to start treating at least this subset of breast cancer patients without chemotherapy, who normally get pretty high doses of chemotherapy, is pretty remarkable when you think about it.
For Dallas, this is another step in her fight to be here for her family.
And to be able to still be here with my kids, it's just all I want. I just really, really need to be here with them because they have a lot of people that love them. But I want to love them and take care of them.
Another big part of Dallas's story is how she advocated for herself. She said something felt off, and she kept saying something was wrong until someone listened to her. And clearly she was right. She says you know your body best and find someone who will listen. In the studio, I'm Lauren St. Germain, ABC Action News. Veterans and service members from all over the country come to the James A. Haley Veterans Hospital here in Tampa if they have spinal cord injuries. The hospital has a specific clinic using exoskeletons to help patients walk. I recently went to the center to learn about the technology that is life-changing. And tonight, I'm highlighting the voices of a member of the Air Force, a physical therapist, and a doctor.
Ever since I was kind of younger, I knew I wanted to join the military.
Sean Stutson landed in the Air Force as a firefighter.
Peterson Space Force Base was my first and last base that I went to, and I spent about 2 years there.
Sean brings us back to when he was at the base in Colorado in August of 2023.
There is where I had an accident. I was hiking and fell off a cliff, about a 50-foot fall. Ended up gaining a spinal cord injury and breaking a few bones.
After treatment in Colorado, Sean came to James A. Haley for rehab.
Exoskeletons are machines or powered equipment that allows patients to be able to walk. And it offloads all the weight for them.
Dr. Kevin White is the chief of spinal cord injuries at James A. Haley.
Why is something like this so crucial for a veteran?
If you ask a veteran when they get injured, one of the first things they want to say is, I want to be able to walk.
We're one of the only hospitals who's taken exoskeletons out of the regular physical therapy clinics and put them in a separate clinic. So this clinic only sees patients who are using exoskeletons.
Dr. Catherine Fitzgerald is one of the physical therapists working with patients like Sean.
This is the exoskeleton. It's one of our rehab exoskeletons here. So we use this mainly for patients who are working on recovering their ability to walk. So it does part of the work of walking, depending how much help that patient needs. It does as much work as they need it to do, and then we try to taper down how much the exoskeleton is doing so that the patient is doing more.
Good to go?
Yeah.
I wouldn't be walking, I wouldn't be up on my feet, I wouldn't have the life I have right now, or even the chance of a life I have in the future. I owe it all to this.
What was it like to take that first step for you?
It was very frustrating because I was trying to make my foot, trying to make my leg move, and it wasn't.
Sean has been working with this technology since December.
I had to start first thinking right step, shift, lock out, left step, shift, lock out. Where now it's much more natural.
I mean, you really are learning how to walk again, so it makes sense.
Learning how to walk without being able to feel where I'm at. It's really hard.
It brings a lot of hope to people, the veterans who are using it, and also the veterans who get to see people up and walking around using this technology.
What's the goal?
The goal is a better life today than it was yesterday. I would like to see myself be able to walk again, but if I can just have a better life, that's what it is. Enjoy, have a fulfilling life.
I'm Lauren St. Germain. You often hear about organ donation, the need for transplants, the decision if you should be an organ donor, and families who have to make that decision for loved ones who left too soon. What you don't often see is family of the donor meeting the person who received the life-changing gift. Recently, two families allowed me to witness this moment and have a heartfelt conversation so we could all share the power of organ donation.
He was full of joy and love.
Durbin Manuel Huertas, a son.
He was funny.
A brother gone too soon.
He was a good kid.
He passed away suddenly last year from diabetes complications at the young age of 15.
He was like a giver, like everything he got, if you will ask him for something, he will give it to you.
Now, giving the gift of sight to Art Dersheimer.
I don't have the words to express my gratitude.
We were there when the families met for the very first time.
When I hug him, I just feel that peace inside my heart. It was like a hugging my son. I cannot explain it, but I feel the same sensation that I was feeling when I hugged my son.
It's a good sensation knowing that my son's still giving, even though he's not present, physically, but he's still giving life to someone else who needed it.
What this family has given me, what they gave me with the cornea from their son, is a gift that I can't describe.
I know organ donation, you were debating at first. You said no at first. Walk me through what made you change your mind.
After he left with the Lord, that morning, at 8 o'clock in the morning, I called my daughter. Samantha is a nurse in Seattle. And I called her and I was like, hey, these people are bothering me so much. They don't understand how I feel. It's so hard. And they asked me if I wanted to donate, his organs. And then she told me, I cannot tell you what to do, but just think about it, how many lives you can save and how many lives you can change. So I told her, well, I'm gonna pray, I'm gonna think about it, and we'll see. I feel him. It was like he was next to me, like he touched me. I feel his breathing next to my cheek. And he told me in a pretty peaceful and mellow tone of voice, like, Mom, like that. So every time he want me to do something for him, that's the way he talked to me.
It was at that moment she knew she had to donate her son's organs.
The gift they gave me was a gift of sight. Absolutely the gift of sight. Gave me my sight back.
Dr. Brian Foster did art surgery. He told me a cornea transplant is pretty common. He personally does 1 or 2 a week, and the procedure has a very high success rate. The cornea is the clear lens that covers the front of your eye.
The cornea is unique in that it's actually, it gets nutrition from the fluid inside the eye. So it doesn't rely on blood for nutrition. And so it's actually an easier process to find organ donors for corneas than other organs.
It's not going to save your life, but it will definitely save your quality of life.
This type of transplant is possible through organizations like Lions World Vision Institute.
We provide sight for those that are blind or visually impaired, and we do that through donation.
The nonprofit is a combined eye bank, tissue recovery, and ocular research center. They helped this donation happen, from the recovery of the cornea to matching it with a recipient.
But I think that our loved ones, if we donate, they're gonna continue living. They're gonna live, they're gonna give life to somebody.
For them enduring such a tragedy of losing a child and then having the strength of character to do what they did.
And you said your son was a giver. This seems like the ultimate gift that he gave to people.
Yes.
We never talked to him about this because we never thought he was going to leave early. But if we would have asked him, I know he would have said yes. That was him. So I got no doubt that he would have said yes with a smile. So we miss him, but I know he lives. We will see him one day again.